When someone asks me what I do, I get so excited I want to say it all at once. But the best way that I will say is I help sick people to get better.
We started PACT back in 1997 because we were concerned about the shift towards HIV among people of color and HIV among poor people. And we were very concerned with the fact that just in our neighborhood, even though we live within walking distance of some of the best medical institutions in the world, not only were we seeing higher rates of HIV infection in young black women in particular, but that if you happened to be a young black woman who was infected with HIV, you were so much more likely to die from your disease. And so the issue became for us, why this inequality? Why in this country should we see these disparities? So we are recruiting community health workers from the community where we were seeing the epidemic and where we were seeing people struggling, and basically supporting them to become experts and professionals in the care of their neighbors who were struggling with HIV.
I go to my patients' home to watch them take their meds. I, help them out with side effects. Help them, I'm an extra support for them to take their medications. I like to listen to, their life stories. I like to get to know them better. I like to be able to have a good relationship with my clients, because that helps me to find out what is their boundaries, what is that it's disabling them for taking their medications.
It's just the struggle with the diabetes to get it under control. Because when you go to the doctor, they tell you, oh, you have diabetes, but because they're so busy, they can't really sit down and explain what is from what isn't. Since Grace came into my life, is like she sit down and explain how diabetes works, the ups and the downs, and how the insulin works and the pancreas and stuff. So all of that I didn't know before, and it's much better than how it was. So she's very, very good to me, and I really appreciate her. Thank you so much.
It was wonderful. Shirley was one of the first patients that I started seeing, and so I'm lucky to have such a good patient, because she inspires me too, because you're very positive despite all the hard things that you go through.
Yeah, thank you. We really have a good relationship. She's my friend, best friend, so I feel good.